Welcome to Dental Unscripted, where Mike Dinzio and Paula Quinn break down the practice ownership journey, one episode at a time. Starting up, buying, and running a successful dental practice.
All right. Welcome back, guys, to another episode of Dental Unscripted. I am one of your hosts today, Michael Dinzio, one of the founders at Next Level Consultants, and we also have the pleasure of having Miss Paula Quinn, my partner at. Hi, how's it going? Did you see me dancing down here? I was like jamming to the beat.
To that beat. It is a pretty good beat.
I know it gets the juices flowing. Well, hey guys, we got a good episode today. It's about taming the wild. And no, we're not talking about Paula's hair. What we are talking about is team members, and team members can be crazy, wild, fun, challenging, stressful, all the things. We're going to just talk about some of the things that we do to help team stay focused, stay accountable, results driven, ownership mentality, fun stuff like that. So
we had a few of our wild
children,
wild team members on here.
Yeah, we should. Maybe they will chime in, since they didn't chime in on the last episode. Guys, if you're listening, ladies,
you know who your wild ones are.
You know who you are, and you need to participate to the program today. All right. Well, before we get too far, I got some housekeeping. If you are watching our program on Dental Unscripted, this is Dental Unscripted. If you're watching, listening on Startup Unscripted or Dental Acquisition Unscripted, you need to get over to this channel, which is the real channel, the new channel that we will be continuing our program on. This is going to be the only one. We are shutting those other two programs down and going all in on this one. So Dental Unscripted, it's a navy blue kind of turquoise with a tooth. Big shocker. We got a tooth in our logo. Everybody does on these podcasts. So please join, subscribe, review us, all the things. The other thing you'll notice in my background is our newest partner and sponsor to today's episode, Candid Pro. You all have heard of aligners and clear aligner therapy. There's a lot of choices out there, but we specifically partnered with Candid because of a lot of things. So before we get into it, I'm going to read a little thing that they wrote up for us because it's way better than I could ever do here. So Candid Pro is a clear aligner system built for general dentists. I know a lot of folks who are coming out of dental school and are interested in profitable therapies like aligners, but they aren't always confident enough to jump right into it. And that's so true. Paul and I could talk to you guys about all that. Like, a lot of our clients are very concerned about clinical and, the risks and all the things. But one of the reasons is the things that they're doing. And so with Candid Pro, you'll get a US-based licensed orthodontist reviewing and approving all of your treatment plans with no additional cost. And I think, and Paula thinks, that's huge. It's a huge value. And I think it will deliver great outcomes. Also, because you're a friend of me and Miss Paula here, you do get a special offer. Now, I'm going to say, guys and gals, this is actually a really good offer. Okay, so you're probably hearing a lot of good offers out there with other different programs and stuff. This is actually a really good one. You get 30% off your first few cases, and you get gold, I think, tier for 6 months. So you got a very short window, 6 months, but you get an incredible deal. So check out the link below in the description to get that deal. And I think you guys should check it out. I really do. It's a great program. Anyways, without further ado, let's get into it. Taming the wild, not your crooked teeth, but team members. Taming the wild. So I'd love, we're just going to kind of freeform this because to be honest with you, that's how unscripted this program is. It's very unscripted.
I was like, don't we always freeform?
Yeah, we always do. And and I think it's what you all want. We don't prepare much other than we know what we want to talk about, and this could go anywhere. But I think I know one of the number one things our clients would say is the hardest part about running a business is not clear the clinical aspect. It's not the business, even though the business can be challenging. It's the team, right? It's the team. And I think a lot of folks hire us consultants to help them, help us with helping them.
Help me help you.
Help me help you. Tame the wild. And so, Paula, would you agree to that? I think you would. It's the team, right? When you owned?
No, I'm just kidding. Yes, it was.
We got a very difficult guest on co-host today.
Yes, it was definitely the team.
What was so hard when you owned? Like legitimately, like why was it hard to work with team and get them to do all the things?
Well, I think, you're a business owner and this is your entire livelihood. A lot of times the extra money comes to you. So you're obviously, the more you make, the more, you get to take home. This is your business. I think that it's your blood, sweat, and tears. And then you've got people working for you. They get the same amount of money hourly that they get, whether they kick it out of the park or their status quo. It's a job. So the trick is, and they've got a life. And so, some of the, I've been around for a long time. So a lot of people in the workforce have a little bit different work ethic than some of, other generations. And so you find that, coming in late or being on your cell phone or, whatever that might be, can take priority over the job. And I think that especially
the job.
I actually think, especially since COVID, things have changed too, where a lot more things are done online. So people are thinking, oh, do I really need a 9 to 5? I can do this, I can do that, I can dabble, I can, so there's like a whole mind shift of work ethics and different things and what people want in today's world and how they want to make money. So you're dealing with that. And so it just makes it really hard to get them ignited and passionate and at least half of where you are when it comes to driving the business, So I think that's the hard part. It's, and then the bigger your office is, the more personalities you have. And I joked about this before, but there is typically women in a dental practice, and we are typically the, take care of the children and the household and different things. So when we're in the workforce, it's like our mind is in different places. So I think it's just human nature. And I think it's such a small business that the owner is the person running the business is the owner. So we're sitting here thinking, oh my gosh, this is great. This is our business. We're going to make money and we're going to service patients and like, let's all get passionate. And they're like, all right, so it's the people. Absolutely.
It is. And what's interesting is like, I mean, to say that all that, like, in one way is like you're giving the keys to your baby, right? For $28 an hour, someone making $20 an hour in some state.
You're in Seattle.
I am sitting in Washington. So yeah, it's 28. So yeah, I mean, even more shocking for me to hear that, because you're right. $20 is like, I mean, I'm not going to say it's McDonald's wages, but I am going to say that like the job force, the folks that are applying are trying to better themselves from the service industry, from driving Ubers, from like, and we're literally just kind of letting them run our business. And then we get mad. We get mad that they don't care as much as we do.
Well, and let's talk about like, it's a small business. the taxes, the overhead is outrageous. So,
Yeah.
I'm not saying every practice, it depends on the practice. So I'm on forums all the time on Facebook, and they're like, we don't get benefits. And this is the first time a hygienist has ever gotten benefits and blah, blah, blah. And yeah, there are a lot of great things, but dentists can barely with especially if they're a fee or I'm sorry, not a fee for service, if they're a PPO provider, if they accept dental insurance in their practice. I mean, it's highway robbery. And so they're sitting here getting, I won't say the word, over on this end and then on this end. And there's nothing more than they probably want to take care of their employees, but small businesses are stuck between a rock and a hard place when it comes to making money, taking all the risk, and then also trying to pay and make the team happy. Any small business.
I mean, we know we're small businesses.
That's what I'm saying. Any small business. It's like, it looks like when you're a $1 million business that you're probably taking home 500,000 or 800,000 or 300,000. And it's just not always the case. It's
I know
$1 million business. The dentist could be making 150,000, which, by the way, they have student loans, they have a home, they have
practice loans,
they have their wife, or significant other, I should say, kids, all those things. 150,000 isn't a lot of money for
someone in California or Washington.
Or people who are still paying off loans and trying to, here they go into this, I'm a doctor, and it's like,
that's right.
But are you? No, I'm just kidding.
No, you are, but you don't have a
You
paycheck.
are, but are you getting paid like one?
Exactly. So I guess that kind of so that tees it up for today's discussion, is like, that's the problem. That's the problem. And I follow Gary Vaynerchuk. He talks a lot about this. Owners, get your head straight. Get your head straight when you're working with your team. But what
does he mean by that? I know, but tell our audience what he means by that. You
just appreciate the fact that they're never going to be an owner, and you can do all the things, but they're never going to be you. And you should run your business, and you should care more, and you should have this gray hair that I have, and like that's you own the business. People aren't going to do it for you. Like, they do help you.
And you do every once in a while. And I think that is great. And also, on the other hand, again, rock and a hard place, you do have some people, team members, that innately just almost care as much as you do.
And those people are worth gold.
But they're rare, right? That ownership mentality, that I will do anything for you.
Yeah.
And that's great, but that's an exception, and that's an amazing exception if you find that, but it's not.
It is. Mm-hmm. It is. And we just did an episode not too long ago about like why, where am I going with this? I just lost my train of thought, but like, essentially, like, getting your team on board and them helping you accomplish the things you're trying to do. Like, you have to step up, and you have to own, and you have to hold them accountable and run your business. And you just expecting them to drive is not going to work out super well. So, I don't know. I rambled there because I literally lost my train of thought. But so how do we get the most out of our team, Paula? Like, there are so many things that we could probably talk about. This could be literally an hour conversation, but when you are trying to get team members to change or to do a belief shift, a shift, what's your thoughts? I mean, where do you start with that kind of challenge in an office of getting them to shift their brains and getting them to think about things like an owner?
Yeah. Well, I'm not going to brag, but I'm going to brag for a minute. I think, me personally, I'm going to shift to how we as next level get that to happen, or as a coach. But I do think one advantage I have is I have been a team member for 35 years. I have owned, And so I have a perspective or something that I can bring from both aspects that not everyone can bring. So I think I can put myself in the team member's shoes. I can put myself in the owner's shoes, and have empathy or sympathy on both sides, and relate. So I think being relatable is really helpful as a coach. I think how do we actually do it? Is we have different systems, different things that we put in place that I really think helps team members get on board. And I think the one thing we try to come in as collaborators, they have a lot of knowledge. They know their practice hopefully better than anyone. And we tap into that. Now, it doesn't mean that their system or way is the right way, but I think coming in from understanding of let's take what you're doing and not completely change it, but let's enhance it and let's actually systematize it. So, one thing we like to do is get team agreements. We like to make sure that anything we're doing, it's like, are you on board or are you not? Because I think that when I'm told to do something, I might do it if I like it. If I don't, I'm like, okay, sure. People walk away, I go back to the same old, same old. I think if it's, hey, give us some of your ideas. What do you think is great? How do you want to behave and be for your patients, for your team members? Now we're collaborating and now it's their idea. And then I can take that idea and run with it and I can enhance it. I can tweak it, and I can create a system around those so that things don't fall through the cracks and stuff. So I think team agreements are a big one, is bringing them on board with what you're doing, getting their buy-in.
I love that. I think it starts there because a lot of consultants come in, and I don't want to make this about consulting, but even let's just say you guys, you dentists, you come in, you own the practice, and you just start barking what you want to do and what needs to happen. Like a lot of consultants.
It's my vision, right? It's my vision.
My vision, and that's fine. You got to have your own vision for sure, but like they come in, consultants, dentists, new owners, and they're just like, this is what we're doing and this is the way. And without buy-in, that's just not going to work out super well. You're probably going to turn some people over quickly. And that's what we've seen. And I think I liked where you were going, Paula, with this, because I think I was reading your mind here. If you don't have a system, I think this is where you're heading, because getting agreements is great. And that's the start. But the next part of that, after you get their buy-in, is really a system, right? Because if you don't have a system, you can't hold them accountable, right? Without a system, there is nothing to hold someone accountable to. So that's one of the first things that job descriptions and all the things, right? If everybody's just kind of doing it, you can't hold just doing it accountable, right? At all. You have to have a system first, and then once the system's in place, then that's when the accountability begins. I mean, you work a lot with our teams on systems, Paula, really quick, and I see Nicole chimed in. That's great. We'll get to that here in a second. But what's the one thing, not the one thing, but what are some things in the dental offices, Paula, that you see a lot of not very good systems in the atypical practice that you walk into day one? Because we do practice analysis all the time, and there's always systems broken. What's some of the more common systems that break?
Oh my gosh, the number one is insurance verification eligibility.
Yeah.
Do we really know what this patient owes? Do we really know how to present this treatment plan? Are we prepared with this treatment plan? Just really how to utilize insurance, maximize insurance, understand insurance. However, you work for the dentist, not the insurance company. So how to verbalize that to still get what you want done, but help assist the patient along the way with accuracy and preparedness. I mean, that is literally number one. It trickles all the way to the front, to the back. And I think Nicole's thing is great, where it's creating a system where, because that was kind of what we're talking about, understands their role, is empowered to meet expectations. It's that transparency. So what a system does, it creates transparency for both the team member and the doctor. So like you said, when someone falls short of it,
Mm-hmm.
we know where it happened, because there's a repeatable
process.
system, there's a
Yeah.
process. And it's like, let's say that, patient's upset about, we charged them for something we shouldn't have, or quoted them wrong. We start, like, if getting the eligibility and entering it correctly and letting the practice management system work for you isn't happening, everything else is a domino effect from there.
That's right. That's right. Because that is the system. That is the process.
That is the system.
Paula's mentioning a comment that came in from Facebook. It's one of our coaches, Nicole. She says, I think as a consultant, it's about creating a system, all caps, where everyone understands their role and is empowered
All
to
caps.
meet, all caps, empowered to meet expectations. And that's exactly what we're talking about, is systems. But then the empowerment part is also important also.
Well, that's what that system does, is because if I know the job role, I know how to do it, and I know where doctor or we want to go with it, I'm empowered. I don't need to feel insecure about my job. I don't need to feel nervous that I'm not going to do something correct with a patient. I barely even need to go to doctor, because I understand the system. That's where the empowerment comes in, is I can rock at my job now. I know what doctor expects. I know the system. I know the processes. I have all the tools. And I really, the only way I'm going to mess up is, we're human. I have a bad day, like something small, but it should be small and rare, very.
Yeah. And yeah, exactly. I mean, I love that. And again, back to where we started in the meeting, or the meeting, the podcast, where like you have as an owner, you have to like get involved. You can't just be the dentist anymore, like an associate. So getting involved and noticing that the insurance process, treatment planning is not accurate. So dig in, fix the systems created. Now, as the owner, the mom and dad, we talked about beginning of the conversation, now you have to hold them accountable, and over and over and over again, until it becomes a culture. And that's kind of where we're heading, is like this culture. And is culture a real thing, is my question here. And it is. Paula, you always say culture eats
strategy for breakfast.
Yes, culture eats strategy for. I knew you were going to say it. I didn't know if you were going to say it. I wasn't sure. But it's true. And what do you mean by that? What do you mean by that?
You can have all the strategy in the world and all the systems in the world, but if you don't have the buy-in from your team, they're just gonna throw that in the trash, and you're gonna think you've got all these systems in place. They're unhappy at work. They don't get along with someone. They're not buying in. They're gonna trash that. They're gonna do what they want to do.
Yeah.
Even though it's all your little SOPs are right there, it's written down. It should be foolproof. You've got to, which is where we're going with culture, is we do a lot of work on this. And I think that setting your team up for success, I think most people want to help people. Most people want to impress. Most people want to make their bosses happy. They want to make their team members happy. So I think that as long as they feel appreciated, as long as they feel heard, like, anything is possible. And so, I mean, some ways we do. Oh, I don't even, are we still, do you want me to move on? Because I feel like
No, this is great. I'm not the boss. You're the real boss. Everybody knows you're the real boss.
We're talking about, is culture a real thing, and apps a stinking lootly.
I've swore on the program many times. It's
oh,
okay.
you have?
Yeah.
Okay.
Yeah.
No, I'm newer.
Luly.
You've been doing startup and acquisition for a long time. This is only like my third, thing with you. I mean, the F words will.
You're still warming up to the
I'm
crowd.
new, I don't, I'm trying to behave.
No, I think it is I think the thing that a lot of owners miss on is without accountability, I think without accountability, it's hard to create a culture. And here's what I mean by that. Like, if you don't hold your team accountable, the culture isn't to do something. So for example, if creating a 7-star customer experience, how do you get that culture? How do you get to that? Well, that's the standard. You hold people accountable to it over and over and over and over and over and over and over until that becomes the culture of your entire practice. And if someone doesn't fit that culture, you weed them out. But the only way you would do that is by holding them accountable over and over and over and over until you get so sick of telling the same person over and again, hey, dude,
Well, Michael,
you're
but I
not.
think, but it starts before then, and we kind of touched on this with team agreements, and you said, yeah, that's one thing, but I think it's, our core values. We've done this with Next Level is people. They say you hire and fire by core values. So if someone doesn't fit those core values, it's not the right culture. So I think number one, agreements as a team, we all agree to something. Now I can hold you accountable. I think we talk about core values. What can we be okay with, and what are we like, absolutely no. You cross this boundary, you're gone. I think that's it. I think then the transparency comes with the job descriptions. Like, what am I supposed to do? When? How? What do you expect of me? Because if I don't know, I'm going to fail you every time. You have to tell me. It's got to be written. I've got to be able to practice it. So it's got to be repeatable, transparent to other people, so they're not judging me. And
That's right.
And then I've got to be able to practice that and become proficient in it. And that's where we talk a lot about setting goals. Like the team has to know the goals. Doctors are so afraid to share money and goals. Team eat that up.
Dude, they do. They so do. Like, every time we just came off of annual planning and it's still January. We just did annual planning this month is what I meant to say. And I was about to say, I did say last month. And annual planning is one of my most favorite times because we get to declare all the things that we want to do, with goals we want to meet. How did you do last year? What do we want to strive for? So, and every single time we do that with a new client, the office's eyes are open. They're like,
and they say, thank you, right?
This is great.
You.
They always say thank you to Paula and I. And I'm just like, hey, doc, is this an aha moment for you? Because we gave them numbers and they're starving. They're starving for this information. And you were so afraid to share it. If you don't share your goals by numbers, how are they going to help you get there? How? Nicole should have been on the program today. She's on fire right now on Facebook. She said, create a growth mindset culture, transparency in business operations, which we just talked about, align incentives with ownership mindset, like profit sharing. Anyone? ? Accountability 1,000 times over, and without declaring goals, and you can't get to profit sharing programs, and we implement those all the time. So yeah, no, look, this is such a big topic and so hard to do. How could you how do you simplify this, Paula? Like, just like someone that's just kind of getting into this stuff, they're brand new owners, they don't have us coaching them on. Where do you begin? I think, where do you even start with this stuff? All this is a lot.
It takes me back, and this is a little off, but it takes me back where a doctor we coached didn't want the team to know, they didn't know what they were talking about. And they would have us tell them everything, and then they would deliver it because they were so afraid that their team would think they were inept. You know what I mean? Mm-hmm. And I think, there's so much. I gotta let me take this in and say it, and then you can paraphrase it if you need to.
Yeah.
I think you do need to be vulnerable with your team. And I'm not saying you have to be cry and give them your messiness.
Don't be weird.
Yeah.
basically. Don't be
I'm
weird.
saying be vulnerable to know that, hey, I hired a team because I need all of you experts to help me grow. I need your help.
Mhm.
Um, here's what I'm thinking. Here's my vision. What are some ideas of how we can get there together? Again, that's the buy-in, that's the agreements, that's using their expertise. Even if they're a brand new young baby team, they still have some ideas.
Sure.
You don't have to use them all, but you can let them be heard and feel respected. So I think number one is be vulnerable. I think number two is get the buy-in. I think number three is creating the repeatable systems and expectations and job descriptions and the transparency. I think setting goals, learning tools. I think always working on your business, not just in it. You've got to take the time to stop and meet with your team. It's crazy in a dental practice, crazy. We
Absolutely
need to
nuts.
set aside a couple hours a month to sit down as a team and talk. And
Yeah.
the first couple might be like, why the heck did we do this? But give it a chance. Make sure it's not a bitch session. Make sure it's it's about solutions and how to move forward.
Mhm.
I think the last thing I'll say is appreciate your team in the way
Mhm.
they want to be appreciated.
Mhm.
We do an exercise to learn that appreciation, learn the behavior styles. And I think it's really talking to people in the way they like to be talked to. It's appreciating them because the exercise we do is most people leave, they don't leave over money, they leave over appreciation.
Mhm.
So I think you have to be part of the culture. And I joked the other day, I said something to you, I sweep the floor too. I think a lot of it is you're not here and they're here. You're
Mhm.
all in this. It's too small of a business to be that.
Yeah.
I'm not saying there's not a hierarchy. I'm not saying that you're not the boss. I'm saying you're still in this together.
Yeah.
And I mean that's
Yeah. No,
really
no, that I think that was beautiful in the way you kind of work through that. Folks, I would challenge you to literally back this episode up about 5 minutes and get your pen out and literally listen to
I
that.
dropped the mic again on this show.
Well, yeah, drop the mic, exactly. Just literally go through each step, and each step is kinda hard to do, and it's quite frankly a body of work. We work with a lot of newer owners, not I was gonna say younger owners, it's not really true. Newer owners, and this is the hardest thing is we said it in the beginning of this program. It's the team's the hardest thing, and so what you put in is what you get out, and if you're not putting in the time, like Paula said, to work on those things and go through that process, your team will treat this like a job. We always get our clients coming back pissed that they didn't show up or they didn't work through their lunch or they didn't maybe give a big more heads up on sick or their kid issue with the child care, and they're just like always frustrated that these employees, not partners, are
What
disappointing.
profit sharing does, it helps make them partners.
It's right. It's right. It's all these things makes them partners. And then I ask, like, how much time did you put into agreements and systems and getting buy-in and touching base and sharing your goals and with like, and the answer is always not enough. I'm like, well, why are we even having this conversation? Do you just want me to listen or do you want a solution? And the solution is to literally do all this. And yeah, no,
I just
any
want to say
fun
one thing. You mentioned newer owners,
newer owners. Yeah.
but I mean that's a pitfall of a newer owner. But I do think our seasoned
Yes.
owners are honestly checked out of the business, and they're just letting the
Uh,
team run it, and they don't even know how it's performing until they know it. Until they feel it. We
yeah.
go in so many offices that have been in ownership for 5-10 years, and they have no idea there's $100,000 sitting on the table. They have no idea the front office isn't collecting up front. They have no idea their cancellation and no show is out of control. They only know it if they feel it.
Right.
I
It's
know that
true.
sounds weird, but all of a sudden they either don't have money or they're like, holy cow, my hygienist has been sitting around for 3 hours today. Like it takes something drastic for them to be like, whoa, is this not right? And then when we start digging in, it's like, dude, this is out of control.
Yeah.
So,
Yeah.
or not dude. I guess a girl can be a dude too. Dude.
I've been saying dude a lot to everybody.
Have you?
Yeah. You know, I don't identify.
New words, bro.
Bro. That's too
That's
young.
what my
for
girls
me.
say, bro.
Bruh. Or brah?
Yeah. I don't know how to say it. I'm not cool like that.
If I try to pull that stuff off and people look at me like yeah, I can't do that. It's just,
Yeah.
dude. Dude, where's my car? Wasn't that a movie? Dude.
That was Bill and Ted's Excellent.
Bill and Ted. Oh my God. No, everybody on this program does not know Bill and Ted's Excellent. What was it? Adventure. Check it out. Go to YouTube and watch that. Not this program.
I don't know if it's worth it.
No, it's totally worth it. Well, gosh, like I said, jam-packed episode today. Lots of stuff to discuss there. There's books, there's things, there's all kinds of stuff. Start there, guys. Start there. And ownership. It'll pay itself off tenfold. Most offices can't get to the next level without mastering this. It's a fact. You will plateau. You cannot get past wherever you're at without that. You know,
because culture eats strategy.
That's right. Paula's doing a Pac-Man thing for those that are listening.
They can't see. Oh.
Well, they can, but if they log on and subscribe to YouTube and follow us on there, but most people. All right. Well, again, thanks so much, Paula, for helping me on the program here. But before we head out, let's turn back to our friends Candid behind me, Candid Pro Clear Aligners. We got you guys this amazing offer right out of the gate. You guys get tier gold tier pricing for 6 months. I mean, it's huge for it's called the new provider bundle. If you're looking for a more profitable clear aligner solution, this is exactly what you need. Check out the link below. And all I would ask is you check them out. There's a lot of options, and these guys should be one of them for you. So without further ado, subscribe, do a Google review or whatever. We love you guys, and we appreciate all of your support. And if you ever need help with consulting, buyer rep, startup, just general practice management, hygiene,
front office, credentialing, billing,
all the things we do, please reach out and just have a conversation. If we can't do it, we'll refer you to someone that's better at us in other ways. So, okay. I guess that wraps up another episode. Thanks again, Paula. Talk to you guys soon.
Thank you, Michael. Bye.
Bye.
Thanks for everyone who participated.
Yes. Nicole specifically. Shout out. All right, guys. See ya.
Thanks for listening. Let us know how you like the show. Rate us on Apple and Spotify. Subscribe and follow for more.